Hello, my name is Patrick Brown, Mayor of the great city of Brampton, and I'm here with our Medical Officer of Health, Dr. Lawrence Lowe, as well with City Councillor Harkirat Singh for our weekly COVID-19 update. I want to start off by thanking the provincial government for the investment that we've had in our local hospital. The decommissioned Peel Memorial, which was decommissioned in 2007 and turned into a day clinic, an urgent care clinic. Last week we got the go-ahead for it to be a full hospital. So I just want to start off this press conference and thank the provincial government for that that support. The application for Phase 2 of Peel Memorial it was very robust, over 250 beds, a 24/7 emergency department, not to mention 24/7 operations. And I just want to acknowledge Councillor Singh, who was enthusiastic in his push to make sure an emergency department was included. And so we're grateful for that inclusion. A city the size of Brampton, it made no sense not to have two hospitals, so that was a good day for our city. And the bonus was that we're getting a med school as well. So I was a pretty happy camper last week at the provincial budget. I also want to thank the province for the changes that we advocated for within the gray zone. As you know, I've spoken on my weekly press conferences about the need to have less restrictions on outdoor amenities, and additionally some understanding for the personal care sector. And Dr. Lowe from Peel Public Health had made submissions to the province on ways that we thought these could be safely achieved, and I'm grateful for the province responding and making those amendments. And just to reiterate, for people being outside, it's low risk, it's good for their health, it's good to be active, it's good to get fresh air, and I'm glad that there's going to be a willingness to accommodate that. And in terms of the personal care industry, it was turning into an underground economy. People were simply going to someone's basement for personal care services or going to another city. And the fact that we're recognizing that we are losing patients with the public since we've been shut down since November 23rd. It was time to have some allowance for those personal care services. The fact that they're going to be permitted within capacity limits on April 12th is something that I welcome. I have a few City of Brampton updates. We understand that this pandemic hasn't just been a health crisis, it's been an economic crisis for residents. And so we have announced a property tax deferral program for 2021. As you know, last year we allowed residents to defer their property taxes. We're allowing them to do that again this year, but they have to apply by April 15th. There'll be no penalties, no cost for delaying payment of your property taxes, understanding the difficulty that this year has presented for so many families. In terms of Easter weekend services, I would like to note that Good Friday takes place this Friday, April 2nd, and Easter Monday on April 5th. For our essential services, they're all going to be operational, but city services will be closed. I understand that it's a little bit different. You can't have family gatherings. You can't call loved ones over for an Easter dinner, but we are trying to have some fun online contest in the city of Brampton. Residents can pick up their Easter craft kits and make a colorful pot for their spring flowers. These are all available through the Recreation website at brampton.ca/recreation. And we're also launching today an Easter egg painting competition where we're going to be giving out a gigantic Easter egg to the a young person in Brampton that paints the most beautiful Easter egg. So we're looking at fun ways to have some Easter fun even during the pandemic in a manner that is safe and socially and physically distant. In terms of an Osler update, the William Osler Health System continues to do great work. Thank you to Dr. Naveed Mohammed and his team. Their update is that they have 45 COVID-19 inpatients at the Brampton Civic, including 8 people in ICU. And I should underline, for a long time we were seeing the hospital numbers creep down. What we're starting to see now is the hospital numbers get up. And so those are increasing hospital numbers, and so we're starting to see the hospital capacity challenged once again. There's also 33 COVID-19 suspect patients who are awaiting test results, so the capacity could even be further challenged very soon. In terms of testing, they have completed a total of 383,933 COVID-19 tests. And in terms of vaccines, Osler has administered more than 48,800 COVID-19 vaccines, with the current capacity to provide about 1,350 a day in Brampton. I would note, and I've said this again and again, we have a capacity for much, much more. It would be very easy for Brampton to scale up. We've got the mass vaccination centres open. We have the staff. The only thing we're missing is supply. Supply. That's the issue, and it's why GTHA mayors have been advocating loudly that, we're Canada's hotspot. We need vaccines. And as soon as we get supply, we're going to be able to protect our residents in a very fast fashion. But that missing component continues to be supply. On that note, I'm going to invite Dr. Lowe to say a few words, as he does a great job protecting our residents in Peel.
Thank you, Mr. Mayor, Councillor. Good morning. Good morning, Brampton. This week, Brampton's test positivity is at 14.5%, which is up from 12.2% last week. Brampton's weekly incidence rate is at 227.3 cases per 100,000, which is up from 174.5 cases per 100,000 last week. We are also seeing an increase in hospitalizations here in Brampton, and patients that have been infected with the variants are increasingly of a younger age group, stricken with more severe symptoms sooner and staying in hospital longer. So at this critical juncture, I must make two messages completely clear. Firstly, on vaccines. If you are eligible for vaccine, please make an appointment to get vaccinated now. All of the vaccines protect against severe symptoms, and the sooner you're vaccinated, the sooner that protection helps you and helps our community. I cannot stress enough, please get vaccinated. Now is your time if you are 70 years and older, an Indigenous adult, or a prioritized health worker. If you know someone in our community who is 70 or older that needs help to book or help to get to an appointment, please lend them a hand. You can find out more information on booking for a vaccine and having your questions answered at peelregion.ca/COVID-19 vaccine. You can also call 905-791-5202 7 days a week from 8 a.m. to 8 p.m. if you can't book online or need help doing so. Our call line is quite busy, so I encourage for those who call to please be patient. Our staff are helping many seniors get their appointments booked, and they take the time they need to make sure that it's done right. But again, if you are eligible, please take your chance to be vaccinated in priority now. More and more appointments are available each day, and as supply continues to grow, more age groups will be unlocked. So now is your opportunity to be vaccinated in priority sequence. Secondly, our gradual reopening into gray lockdown has clearly prevented the significant rises observed in other jurisdictions that have opened ahead of us. We have seen how many other municipalities in Ontario that opened into less restrictive areas of the framework started driving our provincial case numbers a few weeks ago, many of which then returned to the most restrictive parts of the framework in response. Unfortunately, as the variants start to take hold, our own measures here in Peel are no longer holding back case growth and subsequently hospitalizations. The picture being seen elsewhere in Ontario is again now here in Peel, and we must double down on the critical goal of holding the line until the protections of vaccines takes flight. Our conversation must turn away from the loosening of measures further to focusing on what can we do to stop this resurgence. I've previously said that reopening for the sake of reopening is not victory. Any further loosening of measures at this time, where vaccine coverage remains low, will mean lives lost and severe disease, especially among younger and middle-aged adults who are increasingly more vulnerable to the variants of concern. It will also mean prolonging the pandemic in our community. if we have a surge that requires more vaccine to bring down in absolute numbers, and if we have to divert attention and precious resources away from our vaccination campaign. So we need to hold the line, please. Continue to stay at home as much as you can. Prefer the outdoors to indoors for any interactions. And whenever you meet anyone outside of your home, ensure that you are distancing, masking, and limiting the numbers and duration of your contact. And if you are sick, please do not go to work or school, get tested, and self-isolate. We also need to vaccinate quickly as possible, so I will reiterate, if it is your turn now, please book and get the vaccine. peelregion.ca/COVID-19 vaccine has all the information that you need, and if you can't get an appointment right away, try again later. This race is far from over, and I'll thank you now and pass it back to Mayor Brown.
Thank you, Dr. Lowe, and I'll invite up Councillor Harkirat Singh to give a bylaw update. And I should just thank everyone, first of all, for the high level of compliance we have with these public health protocols. We continue to see a high level of compliance, and so thank you to Brampton residents for taking it seriously.
Thank you, Mayor Brown. Your advocacy on the hospital and the med school is very well appreciated by our residents at the City of Brampton. Good morning, everyone. My name is Harkirat Singh, and I'm the City Councillor for Brampton's Wards 9 and 10. From March 22nd to 28th, officers laid 23 charges, which included 8 charges that were under the mandatory face covering bylaw and 15 charges which were under the Reopening Ontario Act. As a reminder, as part of the province's grey lockdown level, the following measures remain in place to help protect the health and safety of residents. At private homes, socializing is limited to members of the same household. Individuals who live alone, including seniors, may consider having close contact with one other person. At this time, no organized indoor public events or social gatherings are permitted. And if gatherings are done outdoors, a maximum of 10 people are allowed. We all miss our loved ones, and we know staying apart is challenging, especially as the warmer weather arrives and we head into the Easter long weekend. Please know our individual actions make a difference in protecting our community. We ask you for your continued vigilance and support in following these measures and the advice of Peel Public Health. If you have any questions, please visit our website at brampton.ca/COVID-19 or call 311 if within Brampton. Thank you. I'll now pass it back to Mayor Brown.
Thank you, Councillor Singh. And on that note, I'm happy to take some questions for myself, Dr. Lowe, or Councillor Singh. The first question is from Graham Frisk of the Brampton Guardian.
Guys, how's it going? Just a quick question. I guess the first question would be for Dr. Lowe. Dr. Lowe, what are our vaccine supplies looking like at the moment? I mean, like, what are our stocks looking like, and is there enough to keep all the clinics in Peel going right now?
Yeah, actually, Graham, we have started to see steadily an increase in allocation of supply in line with the federal delivery schedules. At this point in time, we have thousands of appointments available throughout the community clinics a day in conjunction with those that are being delivered at the hospitals. On Friday, we saw one of our most significant pushes with 8,000 doses of vaccine administered across our entire system, fully 1 in 10 doses throughout the province of Ontario. So the capacity is there as supply improves. More and more appointments are being made available, but I do encourage residents who are eligible for vaccine right now. Now is your opportunity, and help out anyone who needs some help, 70 plus or over, peelregion.ca/COVID-19 vaccine for further information. Thank you.
Great. Yeah, my follow-up would be for Dr. Lowe as well. Maybe you can tell us a little bit more about sort of the variants right now, and which ones are causing the most problems in Peel Region right now for us.
Absolutely, Graham. At this point in time, B.1.1.7, which was the variant first detected in the United Kingdom, has become the predominant variant in our region. And as I mentioned, it is more transmissible, and there is increasing evidence that it is hitting younger age groups harder, having people come into hospital sooner with more severe symptoms requiring longer stays. Thanks for the question.
And I should just add to that, Graham, that your question was, do we have the vaccines to maintain our clinics? And yes, we have the vaccines for what we're currently providing, but let me be very clear. Our clinics are not being fully used. We have these mass vaccination centers set up. Everything is ready to go, and there is additional capacity, significant additional capacity. And so supply is the biggest issue. Can we carry on with the limited supply we have right now? Of course, but it's not ideal, and I just want to underline the fact that we have the capacity to vaccinate so many more residents immediately, tomorrow, if that supply arrived. I should say we anticipate to be joining the pharmacy rollout any day now, as soon as that AstraZeneca supply arrives, and that will be helpful in our community as well. Our next question is from Shauna Hunt from City News.
Okay, Mayor Brown, I'll start with you since you were just talking about vaccines. What do you think is going on with supply? What is your take on this? The Premier, keeps pushing the blame back on the federal government. The procurement minister is saying, that's not the case. And, supply or vaccine trackers are showing, hundreds of thousands of doses sitting in freezers. So I'm just wondering what your take is on all of this.
Well, I think it's clear that Canada hasn't done a great job on procurement. I take a nonpartisan perspective in municipal public service, and I just look at the stats. I think Canada right now is 55th in the world, and so I don't think you can argue that we've done a great job at procurement. They're doing. You look at some states where they're vaccinating people at the age of 30, and we're still doing it over 70 here in Ontario. And so, for me, I think there needs to be a lot more work done on aggressive procurement. The promise of vaccines being moved up from Q3 to Q2, as the Prime Minister said yesterday, is encouraging, and we're going to get a big delivery of Pfizer in the spring. I wish that happened a few months ago. I don't think we'd be in the situation we are right now with the variants if we had the arrival of vaccines like they did in the US or the UK. In terms of the provincial role, I have argued that there needs to be prioritization for the hotspots. I was concerned last week when the data showed that Brampton was receiving, and Peel Region was receiving less than our per capita share of vaccines, but it looks like that is being rectified right now. As Dr. Lowe said on Friday, we vaccinated 1 out of 10 vaccines in Ontario, which is our population size, and I'm told that's going to continue to be the case going forward. But if for a second I see that that's not the case, I will immediately speak out against it, because the notion that Peel Region wouldn't be getting our per capita share would be bewildering at best, given the fact we're really in a fight with the variants here in Peel Region in Toronto. And was there a follow-up question?
Yeah, this one's for Dr. Lowe, if you don't mind. So Dr. Lowe, I guess you were just talking about, we can't see any further reopening of the economy right now. Is it time to pull back? Do we need to shut down malls, shut down patios, put schools back online? Can we get through this third wave, which data is showing it will be the worst wave? Can we get through this without a really tight shutdown? And should we be expecting it, by the end of the week?
So, Shauna, I can't speak to anything by the end of the week. All I know is that at this point in time, I would not support any further loosening of measures beyond what has already been announced and engaged. I think overall, we do know that you have to wait a certain amount of time to see what happens when you increase interactions, increase those contacts. And we do know, retail reopened, places of worship reopened. We then had, obviously, the outdoor dining and outdoor activities, which are fairly lower risk with diminished transmission. And then certainly the announcement around personal service settings. I think beyond that, anything else is playing with fire, and certainly, we continue to monitor the trends, especially what's happening in the hospitals, with great trepidation. And so certainly, if there would be a need to pull back, that would not be something that I would be averse to recommending. I did want to also add to Mayor Brown's, impassioned remarks around vaccine supply. Peel Region Public Health is one of the health units in the Greater Toronto area that is engaged with the provincial booking system. We believe that is the simplest way to ensure that our residents have access to a one-stop place in order to access their vaccines. One of the challenges, of course, is that we are then beholden to when we are moved through the age groups via the provincial system. So we continue to stress to our ministry partners that we will need to work together to ensure that the priority groups that are identified in that booking system match the supply and allocation that we have here. So it is some part supply, but also making sure people can access through the provincial booking system in a timely manner. And we're hopeful that all of these will continue to get ironed out as the rollout continues. Thanks so much.
Thank you, Dr. Lowe. Our next question is Nikki Sedrone from the Bramptonist.
Hi, good morning.
Morning.
Last summer, the City of Brampton created a support program that offered home delivery of groceries to seniors who weren't mobile and in need of support. With the arrival of vaccines, we've heard that the same challenges continue to exist with many of Brampton's elderly population wanting to get a vaccine, but for health reasons, lack of transportation, or any number of reasons, remain isolated and can't get to a vaccine center. Given the success of last summer's delivery program, and granted I appreciate delivering groceries is not the same as delivering vaccines, is the city considering reinstating a similar program like the one Mayor Tory announced in Toronto to deliver vaccines and help increase the vaccine rate amongst the elderly?
So great question, and I would note that we recognize that some seniors are mobile challenged and are not able to get to a mass vaccination center. And I believe Dr. Lowe has already started on looking at ways to protect those seniors that may not be able to get to a clinic on their own. I know at Holland Christian Homes there was a site visit because there was a significant number of seniors that weren't able to get to a mass vaccination center. But I'll pass this to Dr. Lowe to share his plans on how we're going to get to seniors that aren't able to have access to public transit or a car.
Yes, thanks, Mayor Brown. Thanks, Nikki, for the question. Certainly, seniors and individuals with mobility issues who may be homebound or largely homebound are part of our prioritization here in the Region of Peel. At this point in time, there is support to get to mass vaccination sites via TransHelp. So you don't need to be a TransHelp client in order to order TransHelp online. 905-791-1015 is the number to call, and you can organize it, especially if your appointment is 24, 48 hours. Make sure you give TransHelp a call to get a ride. The other thing that I will mention is we have been finalizing our plans with Ontario Health and their home care team to identify how we are going to start going into individuals' homes that may need that support, and we're hoping that there will be further information that we can release after the long weekend. And the last thing I'll mention is that we have continued our mobile clinics, and we have vaccinated almost half of our seniors' apartments and senior congregate settings throughout the region, with the other half slated to be finished up in the next few weeks. So there are a lot of different channels that are currently underway, and I'm hoping that we'll have further information on our work together with Ontario Health's home care team in the week to come. Thanks so much.
Thank you. That's it. I have no more questions.
Thank you, Nikki. Our next question is nitinChopra from Prime Asia TV.
Good morning to all. My first question is to Mayor Brown, because yesterday we heard that 3 vaccination clinics closed down in York. They halted their operations. Toronto District School Board, 5 schools are off now. So what is the condition of vaccination clinic here in the Peel?
So right now we're able to administer the vaccines that we are given, but we could certainly use a lot more. In terms of the state of the schools, I'll have Dr. Lowe offer his input there.
Yeah, thanks, Nitin, for the question. In respect to schools, we continue to monitor the situation. We do know that schools reflect increasing transmission, and as I mentioned in my remarks, it does seem that the measures that have held the line in our region for so long are really starting to wear thin, unfortunately, just in the last week. Either it's just the measures themselves, the pandemic fatigue, or the loosening of some of those measures that has taken place. We know that we're seeing increasing case counts, so we are seeing that reflected in cases detected in schools. But at this point in time, we continue to monitor the situation with our school board partners, and we'll render any recommendations as needed. Thanks.
Follow-up for Dr. Lowe. Dr. Lowe, in terms of the AstraZeneca vaccine, why science is different for in U.S. There is no gap for the second dose, even for AstraZeneca for 16 weeks. Here in Canada, when seniors getting a shot, now 55 below, they won't get a shot. 20 days over, if you got a first shot, then it's okay. If it's less than that, then now everyone is saying watch for your side effects. So seniors are very concerned and they are bothered about this. And why science is different in U.S. and why different in Canada?
So again, these are guidelines that are put out by the Federal National Advisory Committee on Immunization. They continue to monitor and provide input based on the science as it evolves. And certainly, should they need to revisit the dose interval, they will. At this point in time, I have confidence in it. From an immunologic perspective, it makes sense. You give a prime and then make sure that they're not too close together. You give a boost later on. But of course, the data is continually being revisited. So thank you very much, Nitin.
Okay, thank you, Nitin. That completes our COVID-19 press briefing today. We have City Council at 9:30, so we have to start our City Council meeting. I apologize for those that we weren't able to answer your questions, but stay safe, and until next week, we look forward to once again reminding the public, do everything you can to listen to the advice of public health. There are better days ahead.